Well, hi there, and welcome to Time to Talk Traumatic Brain Injury, the podcast for survivors, by survivors, for the entire brain injury community. Traumatic brain injury, TBI survivors, require attention and dependence from their primary caregiver. This is because TBI is a deficit that affects both the psychological and physical functions of the victim. Caregivers play an essential role in providing the adequate care victims need to adjust to the new problems they may experience due to their condition, as family members alone may not be able to provide for their needs. In particular, TBI caregivers may face specific challenges when assisting their patients in handling unexpected changes to their daily routines. Even when the brain injury has gone through rehab and is doing much better, they still need questions answered to know what to do to keep their brain active and healthy. Today on Time to Talk Traumatic Brain Injury, the podcast, we get questions from survivors and do our best to answer them. Today on Time to Talk Traumatic Brain Injury. Our first question comes from brain injury survivor Dawn, who wants to know about how to keep a healthy brain.
What kind of physical activity will help my brain?
Well, Dawn, to get an answer to your question, we asked Dr. Lories, a physiotherapist, to give us the answer. Dr. Lories responded by saying that everyone knows that exercise helps your heart, but what about your brain? There are well-known links between cardiovascular health and brain health, she said. Lories recommends her patients get 20 minutes of aerobic exercise, a workout that causes you to sweat 3 times a week. It really changes the A study from 2023 from Dr. Lories' colleagues showed that combining aerobic resistance exercises with cognitive training gave the best results for improving global cognition in older adults with mild cognitive impairment. Your brain is an oxygen-hungry organ, and exercise increases both oxygen and blood flow to the brain. You want to keep brain healthy, stay physically fit. Dr. Lories was also quickly to add that over time, bad sleep can have a negative impact on brain health and puts us at risk for certain brain diseases such as dementia. A system in our brain called the glymphatic system, which was only discovered in 2012, is integral to cognitive health by helping the brain get rid of waste. It's a natural, effective detox happening during sleep, she said. If you struggle to sleep well, it's important to figure out why and get medical help to try to sleep better, she added. Well, Don, we hope those answered some of your questions. Now it's time to move on to our next question from another brain injury survivor. Here's an interesting question from brain injury survivor Eddie.
Will playing Wordle every day help my brain health?
Dr. Lories answered this question as well. She said, we may think that regularly playing Wordle, crosswords, or other vocabulary puzzles will help us avoid cognitive decline. The evidence for that is scant, according to a systematic review published in 2021. But that doesn't mean they're a waste of time. Puzzles work on multiple parts of the brain, said Lories, including helping us pay attention to recognize patterns and stimulate vocabulary. Crosswords, she said, challenge your general knowledge and help with problem solving. Word games don't improve your memory, though they may help you improve at the particular type of game. Experts recommend you play word games with other activities, like playing alongside friends and family. Wordle is fine, but if you're sitting by yourself and you don't talk to anybody, it's not going to help that much. Our next question comes from a CSW here at the Blue Sheet Clubhouse, who often participates in many of our podcasts.
How do social connections affect my cognitive health?
In the realm of brain wellness, the connection between social relationships and cognitive health is a compelling area of exploration, especially in the context of healthy aging, says Dr. Lories. Recent research from the past decade sheds light on how interpersonal connections can positively influence the brain and contribute to enhanced cognitive function. Recent studies underscore the impact of face-to-face social interactions on neuroplasticity, the brain's ability to recognize and reorganize the form of neural connections. Recent studies underscore the impact of face-to-face social interaction or neuroplasticity, the brain's ability to recognize and form neural connections. Engaging in meaningful conversations, sharing experiences, and forming close bonds have been found to stimulate the growth of brain cells, contributing to improved cognitive resilience, which is the ability to recover from the negative effects of a setback. I had a final question that I would like the answer to. I wanted to ask Dr. Lories, how can learning something new help my brain? The answer to this question was fairly simple. She said it's normal to pay less attention to certain things as we age because we've done them thousands of times. She suggests taking a new route home, for example, from the store, so your brain will have to work a little harder. Make it novel so that you will pay attention, she said. To help your brain, try learning something new that is unfamiliar and challenging. For example, you could learn a new language or a new musical instrument, she said. This kind of challenge in the beginning generates more communication between the neurons. Well, I guess if I picked up a new challenge like learning to cook, this would make my wife very, very happy and increase the strength of my neurons. Well, that's it for Time to Talk Traumatic Brain Injury, the podcast today, looking for the answers to some basic questions from brain injury survivors. If you have any questions that you want answered, please just email us at tbitalks@gmail.com. Thanks for joining us, and we look forward to giving you another presentation of fun, excitement, and lots of education regarding brain injury in the near future. Stay healthy and well. Until next time, take good care. Bye-bye for now.
The views and opinions expressed on this podcast are solely those of the Time to Talk TBI panel and other contributors. These views and opinions do not necessarily represent those of the Cridge Center for the Family Brain Injury Services staff. We value your feedback and comments. Please send us an email at tbipodcasts@cridge.org.